Now, coming back to your achievements, you have invented this Somjee Crabtree temporal support clamp. So please tell our viewers about this clamp, this innovation, and what is it about?
I'll show you a picture. I don't know if it'll come properly on it or not.
Yes, I
Yeah,
can
this is
see.
what it looks like.
Yes.
I don't know if you
Oh,
can see it. Yes, great. Basically, as I said, I always dreamed of being an inventor. But when I was appointed consultant, the department didn't have very much. It had no temporal bone dissection room, which I set up, and I set up a structured training course for the juniors and a series of lectures and meetings, regular meetings in the department. Now, temporal bone holders were not available. So
okay.
I designed this temporal bone clamp to hold the bone properly and to enable dissection. And I'm happy to say it may be the first woman surgeon outside America to invent and market an instrument. The first woman to do this was an American cardiac surgeon who invented a valve.
Okay.
And I'm the second. And it's proved very popular, but not in the UK, more in America and Europe. The UK hasn't got money for it, and the UK tends to discourage the achievements of foreigners. If I was white, they would have rushed to buy it. The paper I wrote on it has been quoted by more than 500 other
Okay.
writers in medical articles.
So that's a great achievement. The paper has been cited by 500
Yes.
researchers. So, are they still using it? They are using this clamp, or they are using another clamp in place in temporal bone
In
surgery?
Nowadays in Britain, it's virtual surgery which is done, so no one is using bones.
Okay.
And in any case, they didn't buy. Only two centers bought the clamp in this country. Downs
Okay.
Esculaps was marketing it. Now I don't know what they're doing in America, but at the moment things have changed so much with
Oh,
virtual surgery and robotic surgery and all. They may not be doing temporal
exactly.
bone dissection, and also I don't think live bones are used anymore. Artificial bones are used,
Okay.
and you can do video surgery, AI surgery.
Yes.
I have a feeling that this now is probably becoming obsolete.
Right. Now, one of your poem, The Street Healer of Karachi, has been included in the fourth year English curriculum. So please tell our
Yes,
audience about this great achievement and about the poem.
yes. In a minute, I'll read it out to you.
Okay.
The story of the poem is that when we were in first or second year, my father had some work in Garden West. So he parked on the street. There were these old houses there, and he went into one of them, and I was sitting in the car and waiting. And directly in front of me, against the wall of this house, this very old man was sitting on a rickety platform, and he was selling basically these homemade medicines and remedies, colored powders, and this and that.
Okay.
I felt sorry for him because he was sitting in the sun, he was poor, and I didn't think he would be earning anything. And our profession tends to look down on them. But he inspired me to write a poem, and I wrote it. And Macmillan, the famous publisher in England, published it. And then it was selected for the fourth year English curriculum in this country, a poem about Karachi in the
Oh,
English curriculum. And it's in the same textbook as Lord Tennyson, William Blake. There are things by Charles Dickens in that textbook too. And it's interesting that when I was in class five and I looked at our poetry book, every poet had been dead by at least 100 years.
oh.
So I thought that to get into a textbook, you had to be dead, which meant that you would never know and would not get in your lifetime. This was my view. And I thought it's sad because I would have loved to have been in a textbook. And my wish came true when I was in it
In
in
it.
life. Now I'll just read it out to you.
Oh, okay.
The street healer of Karachi, on a not too quiet, not too busy street, in the shade of a great jamun tree, against a paint peeling wall on a rickety wooden platform, held by three legs and a rock, sits an ancient man, peering at passers-by through thick spectacle lenses. A poster roped to the wall behind states his age-old profession. Scattered on his platform are bottles, tubes, and jars of yellow pills, white pills, red water, pink powder, all made by gnarled hands with the pain of life and age. He's not a medical practitioner. He sells a few ancient remedies to feed many hungry mouths.
I'm really touched. The idea behind the poem, the way you have explained it, and the last line says it all. So many hungry mouths, and that is the tragedy for a low middle income country, especially ours. And but anyhow, then we pass on to your books. There is a long list of published poems, books, cassettes. You have been singing also. For our viewers, would you like to sing few rhymes?
Yes, in fact, I'll sing a poem. You may have heard of Allama Iqbal's Khudi Ka Sar-e-Neha.
Yes.
I have translated that in poetry form in English.
Okay.
So I'll sing each line, the Urdu or Persian line as it is in most cases, and I'll give the translation below that.
Okay.
This is called Allah, Only Allah for All, based on Khudi Ka Sar-e-Neha. La ilaha illallah, there is no God but Allah. खुदी का सिर निहा ला इलाहा इल्लल्लाह ला इलाहा इल्लल्लाह खुदी है तेग फसा ला इलाहा इल्लल्लाह ला इलाहा illallah. Believe in your innermost self. Allah operates from it. There is no deity but Allah. ये दौर अपने बराहीम की तलाश में है सनम कदा है जहां ला इलाहा इल्लल्लाह ला इलाहा illallah. This decadent age seeks its Abraham to destroy idols. Iqbal, like Abraham, was an iconoclast. There is no deity except Allah. ये नगमा फसले गुलो लाला का नहीं पावन बहार हो के खिजा ला इलाहा इल्लल्लाह ला इलाहा illallah. Seasons come and seasons go. Allah does not sleep. He does not rest or hibernate. He takes no time off work. Nor should we from calling him. There is no God except Allah. किया है तूने बताए गुरूर का सौदा परे बेसूद जिया ला इलाहा इल्लल्लाह ला इलाहा illallah. The life and times of this world are nothing but a farce, fading shadows of what once was. Only Allah never dies. There is no deity like Allah. अगरचे बुत है जमात की आस्तीनों में मुझे है हुक्म अज़ा ला इलाहा इल्लल्लाह ला इलाहा इल्लल्लाह. Idols are sneaky snakes lurking under the hemlines of the sleeves of many worshippers. I do not care. I take my orders from Allah. Allah, only ever Allah. Allah, there is no deity save Allah. Allah, Allah, la ilaha illallah.
MashaAllah, MashaAllah. That's excellent. That excellent. So
Thank
now
you.
from here, Dr. Shehnaz will move on to your law and medical ethics. You pursued LLB honors and became a barrister, and you have your medical legal services. So do you feel that legal training changed your outlook towards patients' right and medical ethics, or it was something else?
Yes. To clarify, I'm not a barrister actually. I'm a
Oh,
qualified lawyer, but I
okay,
haven't done barrister training because to
okay,
do that, you have to leave medicine altogether.
okay,
You
okay,
have to do it full time, and I didn't do that. Um, but I'm good at advocacy, and I can match most barristers. And I've drafted arguments which QCs and barristers have used in the court for my clients
okay.
and been successful. Uh, yes, it has made a big change to my outlook because, firstly, as a ordinary practicing doctor, I saw the good side of patients. Patients were nice to me. I was never the subject of any legal case or complaint, so I liked them. And also, you don't see other doctors firsthand. They're doing their job in the next room or in some other part of the hospital. You presume they're doing as good as you. But as a lawyer, I came across the negative sides of both.
Oh,
I came across horrendous patients who were liars, who were extortionists, blackmailers, wanted money on some pretext or another. And some of them were also racists. They didn't show it in the hospitals, but they give vent to it when they have a dispute. And I also came across some horrendous doctors who had done some terrible things. And so I got a chance to see both sides of the coin of both. And
oh,
I help both because there are also some very good doctors, good patients who have not been given justice. And my aim is to maximize people's opportunities to get justice. I help litigants in person because legal costs in this country are skyrocketing.
it's Cairo.
People can't afford them, and people land in trouble and they can't afford a lawyer. So I do flexible pieces of work at a very reasonable price. I'm non-profit making. And I do it for them, like I give them advice if they want legal research done or a claim form drafted or an argument written. I do these things for them.
That's very good. Now, I would like to ask about some questions from preventive medicine, like from ear, nose, and throat point of view. We have rising prevalence of throat cancer, the cancer of the tongue. So, for our audience, would you please guide them what preventive measures they can take to avoid serious illnesses of the ear, nose, and throat?
I find that in Pakistan, there is no such thing as a no smoking policy. People smoke everywhere. Too many people smoke. Pakistani doctors smoke. And wherever you go, people are smoking and you can't tell them to stop. In Britain, smoking has been banned in public places. My house is a no smoking zone. We need to do that. We need to discourage smoking. So we need to raise the prices of cigarettes and tobacco to a point where people can't afford them. And we need to ban smoking in lots of places and implement the ban with criminal sentences for those who disobey it.
Oh,
Because it's not just the smoker who gets cancer, passive smoking causes cancer too.
cancer too.
And I've seen a horrific case of passive smoking. Well, I know a few in Pakistan who smoked, their colleagues smoke in the office. But in this country, in Scotland, there was a child of 7, and he had a 2-year-old sister, and their parents were chain smokers in the house. The child developed laryngeal cancer, the
Oh,
first child to develop an adult type cancer. The little girl developed leukemia, and the parents had no intention of stopping
oh
smoking.
my God.
Now, he was given radiotherapy, which cured it, but he was only 7. And the question was, what do you do to a child if it grows again? Normally, we would do a laryngectomy. It's never been done on a child.
Oh no.
Firstly, the tissues of a child are growing. So how would the tissues after laryngectomy be when the child grew up? Would it stunt growth? Would it cause distortions of tissues needing further surgery? Secondly, would a child be able to cope with an end tracheostomy, esophageal speech, relearning swallowing?
Excellent.
These were very big questions and they were raised in a clinical meeting and there was no answer to it.
Excellent.
People said, we'll have to just see what happens when the time comes, if it comes.
Exactly. Besides smoking,
So,
in Pakistan, we have recent outbreak of this gutka eating, gutka and pan and betel nut chewing, and that is also causing lot of increase in prevalence of oral cancer, buccal cancer, submucous fibrosis, and we keep on seeing. So that also is to be avoided.
yes, I think the main thing there is actually the supari or the aricocolene, which
Yeah.
causes cancer. Now, what some people are doing here, they are creating pans with non-chalia.
Okay.
They use a kind of artificial chalias made of all kinds of other flavors, rose and other things. And they are not hard as well, so they don't break your teeth.
Oh,
And those make the pan safer with more sweet stuff and less of those. The only thing is the pan leaf. But if you eat only one leaf a day, it won't do you any harm, as long as you don't eat chalia and
right.
tobacco. So we need to do something about that too. I think we need to ban betel nuts.
Yes. Exactly. Now, finally, what message would you like to give to your Dow Medical College class of 1978 friends watching today?
I think I've already touched on one thing.
Yes.
Well, my friends, of course, are well settled, but for the new graduates, I say don't come to the UK. Develop your own because some of you may make it, but those who don't will be heartbroken. As for my friends, they've achieved fantastic things. I think the 78 batch was the best. We did more than the rest. We've had heads of departments. We've had a chancellor like you who made Dow Medical College into an international medical university. That's a great achievement. And then we've had administrators of hospitals. I mentioned Barrows. I mentioned the SNE. But Roshan Ala from our class was administrator of a military hospital. And Badar Jahan was administrator of JPMC.
Oh,
And then we've had people who've created things, as you mentioned in your last interview with Shamim Azhar. He's helping to build a
exactly.
medical college. So we've had people who've achieved lots of things, and then we also built the new surgical complex.
Oh,
Shafiqur Rahman was behind
exactly.
that.
Dr.
So I
Minhaj,
think yes. So
Minhaj
we have
Shafiq,
actually, yes. And I think one Dr. Sharif runs a MRCP course in Canada online. It's an
is,
excellent
I
course.
think, Dr. Shakil.
Shakil, yes,
Shakil?
sorry, Shakil.
Shakil is doing.
Yes, that's
So that's
right.
very good.
Yes, so we have a lot of people who have done lots of good things, and I think our batch probably stands out from all the rest. And
Inshallah,
I'd like to wish all my friends success and thank you for all their love, their support, and their care for me when I come to Karachi.
exactly. Inshallah, I will take one by one most of our class fellows on digital archive. And I am really thankful to you for giving me the time, the opportunity to discuss so many things, to learn from you. And hopefully, I wish and pray for all the success also and for best of health and best of luck for you. Thank you so much, Dr. Somjee.
Thank you so much, Professor Masood. It was very kind of you to have me and give me a chance to air all my views. Thanks again, and I wish your program great success.
Thank you so much. Thank you.